Hello guys, welcome for this advanced cataract course. Today I will discuss about applied anatomy of the eye in cataract surgery. This is an important talk for everyone that start in cataract surgery. Let's go. Here you have, I like this. You have a design eye that you discuss some important points like a resume of the talk. And you can see here in my pointer, the ACD. You write here A, let me put here, ACD, anterior chamber diameter. This 11.25 is the sulcus. This 6.5 millimeters is the distance between the zonal. So, during this applied anatomy for surgery, so for cataract surgery, you discuss a lot of things about it. Let's go. Here is a report, a lens star report that you can see the anterior chamber diameter, that you can see the white-to-white diameter, that you can see the lens thickness. So this is important points in anatomy applied in cataract surgery too. Let's go. Let's continue the talk. Here you have the points that you talk in this talk. Cornea, anterior chamber, iris, crystalline lens, and sclera. Let's go with applied anatomy of the cornea in cataract surgery. Here you have the normal endothelium and you have a Fuchs endothelium. So the most important point in the cornea, in the anatomy, in the applied anatomy, is the endothelium that you can analyze it with the specular microscopy. So here you have a normal endothelium, and here you have an endothelium with Fuchs, for example. So here, a specular microscopy. When you need to do this exam, always. Attention corneal decompensation, polymagnetism, pleomorphism, and dark areas of endothelial cells, cell loss, guttae, or less than 1,500 cells in dense cataract, less than 1,000 cells in normal cataract. In these points, you need to have attention. Okay? Let's go. Anatomic consideration on the implant of the anterior chamber intraocular lens. So here you have an open loop IOL. This kind of IOL is implanted in patients with aphakia. In a lot of countries in the world, it's possible to implant this kind of IOL. So this part, this open loop, can touch in the base of the cornea, in the base of the endothelium, and so it can produce endothelial damage. Okay, so in this part it's important to observe if this kind of IOL can touch in the endothelium of the cornea decompensation. Let's go. Applied anatomy of anterior chamber in cataract surgery. Here you have two patients. The number one, you can observe a patient with a shallow anterior chamber, and here a patient with about normal anterior chamber. So these points are important because, observe, after to remove the cataract, you can observe the position of the IOL here. So this kind of position of the IOL can change the diopter of the IOL that you implant inside the eye. So, for example, this, the pre-anterior chamber diameter, and here the post-anterior chamber diameter. And so you have the ELP, effective lens position. The effective lens position is important to think with the position of the IOL after the cataract surgery. Sergio, but how this ELP can modify my IOL calculation? Let's go. Here, why ELP is important? Observe here. If the IOL stay more up or down, of course, it will move you to modify your IOL calculation. So the IOL formulas, second generation, start with ACD, forecast, variable placement of the IOL in the eye, ELP. Third generation, ELP varying with axial length, Holiday, SRK, Hofer key. And the fourth generation, ELP improvement. So this point, the point of the IOL stay after the cataract surgery, it's important point for IOL calculation, for the generation of the formula that you use to calculate your IOL. Another important point for anterior chamber. Sometimes you observe this eye in the slit lamp, but you can't imagine that stay like this. Observe this large, shallow anterior chamber. So in case like this one, let me put here, in case like this one, observe, try to insert the trypan blue. Let me show you here. But it's not possible because it's a huge shallow anterior chamber. So observe, I perform anterior vitrectomy bypass plan to remove anterior vitreal, and so in this case I can create space in the anterior chamber. And so here I'm inserting the Canberra ring, and so I can perform the cataract surgery, remove the ring, as you can see in this case. And so at the end of the surgery, I will create a suture, do a suture here in this paracentesis in the sclera. So it's important to know the size of the anterior chamber, because the cataract, it can't be more difficult for you during the fake emulsification, and of course because the IOL power calculation.